Over the last few weeks, about a quarter of new cases each day have been in kids under 12. And with Halloween this coming weekend, we are joined by Saskatoon pediatrician Dr. Aisha Kurji to get some perspective and advice. Thanks for being here.
Thanks for having me.
Okay, first off, give me a picture of how COVID has medically affected children in Saskatchewan.
So there's two pieces to that question, or two pieces to that puzzle. Part of it is COVID infection itself, and part of it is the other impacts of the pandemic. When we talk about COVID itself, most kids generally do well and, have some upper respiratory symptoms like a cough, cold, runny nose. Some kids are ending up in the hospital. And what we've seen recently is as our numbers in the community go up, the number of kids who are ending up getting COVID, like you just said, are going up. And that means more kids are ending up in the hospital for sure. The second part of that question is the non-respiratory part, right? So it's definitely, we have to think about the impact on kids in terms of ending up in the hospital with COVID. There's also long-term impacts with COVID. Some of the kids are ending up with long COVID type symptoms, less than in adults. But the bigger impact too on kids is all of the other things that are happening. So now that we've had to cancel surgeries and cancel some in-person appointments, there are kids who can't get surgery. There are kids who are developmentally delayed, who can't get access to physiotherapy, occupational therapy, speech therapy, which can have devastating outcome for their whole life. And the other impacts of the pandemic that we've seen throughout is the impact on kids and their mental health, right? Lots of kids struggling with that as we go through as well.
What did you think of today's announcement of the vaccination plan for kids 5 to 11?
So excited that it's hopefully coming. Cannot wait. I have kids in that age group, so I'm really excited for that, for my own family, as well as for all of the kids that we take care of. I think it's going to be stress relieving for a lot of parents to be able to know that we can protect our kids the way we've been able to protect ourselves.
If the virus continues at this rate pre-vaccination, what do you anticipate will be the impact on kids?
I think we'll probably see the numbers in hospital go up because we just numbers, right? As more kids get it, more kids will end up in the hospital. I think we'll see more kids ending up in the ICU. Hopefully not, but we need to be prepared for as more kids do get sick. Are we going to see more deaths in that population? I certainly hope not, but it's something we need to be prepared to think about for sure.
Personally, I know a couple kids that are forced to quarantine as close contacts or as newly positive cases, and they're going to miss Halloween on Sunday because of it. How important is it for parents to honor the rules around isolation, even though some kids will miss out?
It's a really good question. I think it's very important, right? We know that the best way to protect our kids is to get the cases down in the community. And the more we are out and about, people are out and about spreading COVID, the more those numbers are going to go up. So unfortunately, if your kid has been exposed and isn't supposed to go out, I think it's really important that you stay home and find ways to make Halloween enjoyable at home instead.
Is a Halloween mask a good enough barrier, or should people be masking when they're out?
I would say mask when you're out. We don't know what the numbers of people out there are going to be like. We don't know who's been vaccinated when you're out and about on the street. And how close you're going to end up being. So I would say wear a proper face mask. If you have a Halloween mask as part of your costume, wear that as well.
What tips do you have for parents when it comes to safely trick-or-treating with their kids?
This is a really important question. And, I know there's lots of families who are concerned about going out at all. I do think the important things to remember when we're trick-or-treating is it is outside, which generally makes things safer. Like we talked about, wear a medical mask for sure. Be respectful of other trick-or-treaters who are out. Keep your distance for sure. So if there's another group of kids at the door, wait at least, you're 6 feet away before you go up to the door. Some recommendations are maybe don't ring the doorbell because there'll be more kids touching it, but knock on the door instead. And then step back from the door to allow yourself to have distance between you and the person answering the door before you get your treats. So look at some of the pieces. Make sure you wash your hands before you go out. And when you come home, before you eat your candy, make sure you wash your hands. And then there's also tips that we can give to us as parents who will be giving out candy. Finding ways to create distance, whether it's, using tongs to hand out the candy. Some people were really creative before with PVC pipe tubes to slide candy down so kids don't have to come near your door. Make sure you wash your hands lots and you stay masked. And ideally, the person handing out the candy would be someone who is vaccinated, and it's the same person that's giving it out to decrease the risk and decrease the exposures. And also wipe down all the surfaces like handrails and doorknobs and things like that.
You touched on this briefly, but that dumping of the bag and the sorting of the candy is always a highlight at the end of the night. Any safety tips around how to handle that?
The most important thing is wash your hands before you touch your candy and eat your candy. Last year, there was lots of talk about wiping down the candy and quarantining the candy. Now we know a little bit more about COVID. We know the spread on surfaces is a little bit less of an issue. So the big thing is wash your hands before you eat your candy.
All right. Thank you so much for your time, Dr. Kurji.
No problem. Thanks for having me.
Dr. Aisha Kurji is a pediatrician in Saskatoon.